Movi is a totally new kind of patient transport vehicle. It looks different and it is different. Movi is an exciting medical innovation based on years of research, design, and testing. This video explains the proper and safe operation of Movi. In the next few minutes, we'll cover proper procedures for patient entry, patient transport, patient exit, side transfers, transfer to a vehicle, special features, battery charging procedure, and chair storage procedure. Let's get started with patient entry. After positioning Movi close to the patient, engage both foot brakes. When you greet the patient, take a moment to explain that Movi is different from a regular wheelchair and that it will help them sit and rise more comfortably. Using the control switch, pivot Movi forward. This lowers the footrest to the ground. During patient entry or exit, it is very important that the footrest is always completely flat on the ground. While maintaining physical contact as the patient approaches, stand to the side or slightly in front of the chair. Help the patient stand on the footrest, then assist them in sitting. Explain to the patient that Movi will now move. The footrest will rise and the seat will pivot back in a reclined position. Before reclining the chair, make sure the patient's hands are safely on armrest or in lap and feet are centered on footrest. Make sure the footrest has at least 1 inch of clearance before moving. With the patient safely in a reclined position, you can now adjust the push handle for your comfort. Pivot the handle up or down by pressing in both side buttons at the same time. Ask the patient if she is comfortable. Release both brakes. Now you and the patient are ready to go. Remember that Movi is slightly longer than traditional wheelchairs, so pay attention to the leading edge of the footrest. It extends forward of the patient's feet for their safety. This is especially important when turning and entering areas such as elevators or other tight spaces. Once you arrive at your destination, check for clearance for the footrest and seat. Always engage both independent foot brakes. Tell the patient to expect Movi's seat to tilt forward and the footrest to move down. Position yourself to the side or slightly in front of Movi and maintain physical contact. Tilt Movi forward until the footrest is completely flat on the floor. Ask the patient to wait before standing so you can help them. If the patient does not have adequate strength, they may require your assistance to avoid sliding forward out of the seat. In certain situations, it may be more appropriate to use a side transfer. For side entry from a patient bed, position Movi next to the bed. Lock foot brakes and lower footrest flat on the ground. Lift up the armrest. Position the bed height just above Movi. Then assist patient with transfer. For side exit from Movi to the bed, position Movi and patient next to the bed. Again, lock foot brakes and lower footrest flat on the ground. Adjust the bed height to just below patient level. Now lift the armrest and make the transfer. When transferring a patient to a car, Movi is designed to fit into the corner created by the side of the car and the open door. Position the chair so that when it is tilted forward, it allows the patient to easily turn and sit down in the car seat without taking an additional step. If the patient requires additional assistance, allow enough clearance between Movi and the side of the car, allowing you to position yourself close enough to provide additional stability during transfer. On Movi, everything has a designated place. Carrying oxygen is easy. Just slide the tank into the back of the chair. For IVs, pull the IV pole to the desired height and tighten. Movi allows you to carry patient luggage underneath the seat and in the 2 racks behind the seat. An optional supported leg rest allows you to elevate a patient's leg if needed. Just pivot Movi back and insert the supported leg rest into place. After each patient transport, Movi can be wiped down with normal cleaners. Always make sure Movi is properly charged before operation. Movi's battery tells you its power status with an LCD indicator. When it gets to 25% power, replace depleted battery with a freshly charged battery from recharging station. Movi is designed to store like a shopping cart. Line up Movi behind a stored unit in front of it and push into place. Lift the luggage rack and snap it into its storage position. Notice a security brake releases to secure Movi in position. Now, use the control switch to tilt Movi forward. That's it. Now you know Movi. For more information on Movi, go to MoviMedical.com.